Hello, everyone. On behalf of the Centers of Medicare and Medicaid Services, the Administration on Aging, and the Indian Health Service, I'd like to welcome everyone to the Long-Term Services and Supports webinar series. My name is Sarah Peterson, and I work for Kaufman & Associates. I'll be the moderator for today's webinar. Before we begin, I'd like to highlight some features of your webinar interface. You can see the PowerPoint slide presentation in the main window, and the Q&A box is in the bottom right-hand corner. Today's question and answer period will be at the end of the presentation, but you can enter a question for our presenters at any time in that Q&A box. If you need technical assistance during the webinar, please enter your tech support question in the Q&A box as well. We'll be monitoring it throughout the webinar, and we'll work to answer your question right away. You'll receive an answer sent to you in that Q&A box. Finally, please be aware that today's webinar is being recorded and that the recording will be made available online in the near future. With those announcements made, I would like to welcome everyone to today's webinar. Our topic today is Understanding the 2014 Title VI Survey Results. We have 4 presenters who are joining us today. The first is Mary Kashak. She is the Senior Program Manager in Planning and Capacity Development. She joined N4A, the National Association of Area Agencies on Aging in 2009. She provides technical assistance to community-based organizations with the goal of increasing capacity and sustainability by providing the tools and skills needed to engage in integrated initiatives and diversify funding. She also leads N4A's initiative to determine the impact and success of programs and provides guidance for future planning and training. Rochelle Zylstra is our next presenter. Shelley Zylstra worked for the Northwest Regional Council, an area agency on aging, for 27 years. During that time, she provided support and expertise to Indian tribes and nations to establish, refine, and improve their services to elders. Through this work, she made many cherished friends in Indian country. In 2015, she came to the Administration for Community Living, Region 10 in Seattle. She's excited about the opportunities which abound to continue her work with her friends to establish long-term services and supports in villages and tribal communities. Next is Cynthia LeCount. She has been at the U.S. Administration on Aging since January 2012. She is the director of the Office for American Indian, Alaska Native, and Native Hawaiian Programs. She began her work with tribal elders in 1976, and she is from the Turtle Mountain Chippewa tribe. Finally, we have Erin Long. Erin is an Aging Services Program Specialist with the Administration on Aging within the Administration for Community Living. She was a person who played a critical role in helping the survey happen, the survey whose results we're talking about today. So now I'd like to turn it over to Cynthia and Erin.
Good afternoon, everyone, and thank you for calling in. We're very excited about having done this survey. This is the 3rd actual survey done over a 9-year period. So we're getting some good results to compare and look at. And the intent of this survey is to measure the status of long-term care services in Indian country. And as you know, since long-term care services are now allowed through Indian Health Service as a result of the Indian Health Care Improvement Act, tribes are looking much more towards developing those services, and tribal leadership is getting more involved in looking at and wanting us to develop those services. So I think that the information that we're gathering in this survey with N4A and Scripps Gerontology Center that's funded by the Administration for Community Living gives us some good background information for all of us to use in our planning efforts. Erin, did you want to add anything?
I just wanted to thank you for taking the time out of your busy schedule to join us to learn, for us to share with you what we have learned through this effort to survey the Title VI grantees. And with that, I will send it back to Mary.
Great, thank you guys. Hi everyone, this is Mary Kashuk from the National Association of Area Agencies on Aging. And as Cynthia stated, this survey, this is the third survey that's been conducted over the 9-year period with a grant that we've had from the Administration for Community Living. N4A partners with the Scripps Gerontology Center at Miami University to administer the survey. This is really a partnership between N4A Scripps and the Administration on Aging and Administration for Community Living, because without Erin and Cynthia's input, we wouldn't have ended up with the great survey that we had. This survey was out in the field from February to June of 2014, and although it was an online survey, it was completed almost exclusively through telephone interviews that Shelley Zylstra completed. And so that's why we're so thrilled to have Shelley on the line with us today to provide a lot of context and commentary to the results. In addition to her long history working with the tribes, Shelley spent countless hours on the telephone with these Title VI program directors. And so she has a wealth of information and context about the results that don't always show up in the hard data. So we're thrilled to have Shelley with us as well. And Shelley was able to achieve about an 88.7 response rate. So having almost 90% of Title VI programs responding was very promising. So quick overview, some of the survey topics are connections of the Title VI program to the larger tribal infrastructure, key features and services of the Title VI program, their involvement in innovative care delivery and long-term services and support, elder abuse prevention, expanding services and sustainability, and of course, training and technical assistance needs. And to better reflect the context in which Title VI programs serve their tribal communities, this year's survey was a little bit different than previous years, where we expanded the focus to include the entire tribal consortium or intertribal council. So in many of the questions that we asked about whether the services were provided to elders in the Title VI community, regardless of whether or not the Title VI program specifically was responsible for the services. But as I'm going through my slides, I'll note the places where the Title VI program is specifically responsible for managing or providing the service, whether they were involved in it, or whether or not this is a program or service that is just available in their communities. So in order to do that, I think it's important to understand who the grantees for the Title VI program are, and where their funding structure. The funding structure that supports the individual Title VI program. So about 75% of Title VI grantees are the individual tribe. About 1/5 or 20%, it's the tribal consortium, and a little less than 5% of Title VI program grantees are an intertribal council. And Shelley, I think this goes without saying, but please feel free to jump in anywhere that you have additional information or context to add.
And I absolutely will, Mary.
Great. And so this is one of the most telling slides or, data points that we collected from the survey is when we asked Title VI programs, who do elders call when they need home and community-based services, home and community-based LTSS? And over 50% of Title VI programs report that the elders call the Title VI program first whenever they need community-based long-term care. So I think that was pretty impressive and really huge and really speaks to the reach that Title VI programs have in their community and the visibility that they have with elders.
I think it also speaks to the importance of including Title VI program directors and staff when you're planning long-term services and support. I think so often we work with clinics or we may work with a social service program, but we need to make sure that they are the Title VI directors and their staff are included because there's so much that they can offer, even just anecdotally.
And this is looking at the areas served by Title VI programs. Most Title VI programs commonly serve rural areas. programs serving predominantly remote and frontier communities, not surprisingly, having had the furthest to travel, with the average distance to the most distant elder these programs serve being 166 miles, and the most distant site within the predominantly remote or frontier Title VI coverage area is 254 miles. That's about, over 5 hours away. And so obviously some of these long distance coverages have implications for the services that could be provided. Again, we see a huge variation in the areas served by Title VI programs, the number of sites that each one of the programs averagely have, and the miles to the most distant elder in their community.
I'm going to add here, too, Mary, that a lot of those remote frontier sites are actually up in Alaska, and the villages there have no roads. And so although it might only be 254 miles, it may be much longer than 5 hours to try to get there. They're probably going by possibly bush plane or ATV or another means of getting from point A to point B. So reaching those most distant elders can become a huge issue and really important to the Title VI program.
Thank you, Shelley.
We also asked about the most common funding sources that Title VI programs receive to provide home and community-based services and Title VI services in their communities. It probably goes without saying, but all Title VI organizations receive funding from the Older Americans Act, Title VI. But in addition to that Title VI funding, most programs also received funding from Nutrition Services Incentive Program with a little over 60%. A little under 50% also receive other tribal council funding. A little under a quarter receive funding from Indian Health Services and Older Americans Act Title III funds. Title III is the part of the Older Americans Act that funds the Area Agency on Aging program.
Mary? Yes, thank you. Back to this last slide. We're having a discussion in here and wondering how we interpret, and Shelley, I'm going to need your input here. 100% of our tribes, or about 98% of our tribes, should be getting NSIP reimbursement. I think I have maybe 2 or maybe 3 tribes who get USDA commodities, so everybody else should be getting reimbursement. How do I interpret this number? Are those the tribes who simply did not bill me for reimbursement?
Good question, Cynthia. I think probably what this is, as you're well aware, and I think folks on the phone are well aware, the involvement of the Title VI director goes everywhere from visiting elders to cooking the meal, and in some tribes they're actually an administrator. And I think the administrators are quite clear about where the funds are coming from and what's going on. However, when I was talking with some Title VI directors who were also the cook, they're more concerned about getting the fried chicken on the table and much less concerned about where their funding is coming from. So I suspect that the money is coming to 100% or nearly 100%, but some of the Title VI directors just really aren't all that concerned or involved with where the money comes from.
Okay. So that may be true in these other categories as well?
I'm guessing yes.
All right. Thank you, Shelley.
Sure.
Yeah, and I think that that's a really great point to make, that with any survey, there is always the possibility and the chance that there will be some error for self-reporting, and depending on who you're talking to and what they're specifically responsible for within the program, some of these percentages or numbers could fluctuate slightly.
And that's one of the things that I'm asking folks who are listening to really pay attention to. Remember that this survey was asked to the respondents were the aging program directors, usually called Title VI directors. But are they the best person for us to be surveying about long-term services and support? Is there possibly some You know, I know in Indian country we work so well in teams, and we're all involved in healthcare, and we're all involved in diabetes self-management, and we're all involved in case management without really knowing who's doing what. But sometimes we also are pretty siloed and don't know who's doing what. So I'm very curious to see if other folks on the phone who may be tribal health directors or tribal health planners or a bit removed from my aging program, I'm very interested in your thoughts as we go through this data and information.
Great. Thanks, Cynthia.
Mm-hmm.
So next, this slide is discussing the services that are offered to elders in Title VI communities. And as Cynthia had previously mentioned, this is the third iteration of the survey that we have done. And so this is just showing a comparison between 2011 and 2013. However, for most of the services, they've remained pretty consistent. So whether working alone in the Title VI program, independently administering these programs, or in partnership with other organizations such as Title VI AAAs or Tribal Health IHS programs, Title VI communities have access to an average of 31 services out of the 37 that were actually listed in the survey. So that's a huge wide range and variety of services that are offered to elders within Title VI communities, and just highlighting some of the most common that are administered directly by the Title VI programs. Those are congregate meals, home-delivered meals, information and referral and assistance, social activities, and health and wellness programs. And you'll see that although many of these programs remained consistent from 2011 to 2013, there was a pretty large jump, more so than any other category, in the number of Title VI programs who are providing health and wellness to elders in their community from 2011. So we're going to talk, I think, about the health and wellness activities that Title VI programs are offering that are available in their communities a lot during this presentation. Okay. So that's a nice segue right into my next slide, which is talking about what types of health promotion services and programs are available in Title VI communities. And, you know, not surprisingly, over 90% of respondents said that there are medication management programs available, caregiver support programs available, diabetes management prevention programs, routine health screenings, and general health promotion activities available to elders in their community. Respondents were also asked which programs or organizations manage these specific health promotion services and programs, and Title VI programs were the most likely to assist in the management of caregiver support programs, general health promotion activities, and nutrition, counseling, and education programs that Title VI organizations were most likely to manage independently without assistance from other organizations were the disease-specific support programs, caregiver support programs, and nutrition, counseling, and education. I think it's also really important to note here that on the very bottom of the slide that almost 60% of respondents said that evidence-based programs were offered in their communities. And so we're going to talk a little bit more specifically about the evidence-based programs that are offered in Title VI communities next.
I think that it's important to note here as well that the programs that are offered really show the vast commitment that the programs have to the elders. They've taken the concept of these are just not meatloaf programs. They're actually health programs, and they've taken that really to heart. And I think a lot of the training that happens at some of the summer sessions, as well as the webinars that are offered, focus in on health-related activities, and the directors are clearly taking those to heart and sharing that information with the elders, and I think that's remarkable.
Yeah, that's a really great point, Shelley. When we had presented this information via webinar to the Title VI program directors, we asked the folks on the line with us to share examples and stories about their health promotion and evidence-based programs. And it was really remarkable, some of the really innovative and creative programs and services that they shared, and how they were, getting elders to participate, and how they were growing these programs. I know I was really impressed with the examples and stories that were shared on the webinar with the Title VI administrators.
Yeah, and I think it's also important to understand that these weren't funded programs. These are things that people have put together. They're high-quality programs, and they put them together under their existing funding sources. So very seldom is there additional money available for them.
Right. So what are the most common evidence-based health promotion services and programs that are available in Title VI communities? So I think it was about 116 communities that reported they had evidence-based programs available to the elders. And in 14% of those communities, the Title VI programs either independently managed the evidence-based program or were involved in the management of the evidence-based program. And so the most common that the Title VI programs were involved in managing or independently managing were healthy eating for successful living, heart healthy, diabetes self-management, education training, the Stanford Chronic Disease Self-Management Program, Enhanced Fitness, Powerful Tools for Caregivers, and you can see the other programs that were also common in Title VI communities. This slide is just looking at the most common partnerships formed by Title VI programs. Title VI organizations, on an average, had 11 partnerships, with the most common partnerships being with IHS. And I think, one of the things that we wanted to talk about on today's webinar is, how does this data suggest further collaboration with the Aging Network with the Title VI programs? Obviously, the Title VI programs have a wide array of partnerships, both formal and informal, in their communities. And how can organizations either engage with these Title VI programs or better leverage or utilize their current partnerships? One of the things we learned a lot about was that these partnerships were oftentimes on many levels. We asked respondents to report the level of the partnership they maintained. So, for example, some Title VI organizations reported partnerships with health departments at the state level, the county level, and federal levels. And the degree of those partnerships was maybe a little different in each case. And I know, Shelley, you probably have more context and information to add here, but I know that we did want to discuss, how can other organizations better leverage and utilize Title VI programs in partnership?
And I think that the clear trend that you're visualizing here on the slide is the fact that tribes do really well accessing other tribal programs. They work well, even though tribes can be siloed, they're well aware of what's going on. But when you start to get down into, for example, look at transportation agencies, that given the rural nature of the communities, transportation issues are enormous. And I don't know how many times I heard from elders or from elder directors that their van had passed away, and that was the reason they could no longer provide services. But there are resources out there, and I think helping tribes and programs to connect to, for example, tribal or transportation opportunities to purchase vans or to establish tribal transit programs or connect with Medicaid transportation programs to make sure that their elders have a way to get from point A to point B is really critical. So it's what's there is important, but what's not there is equally important for those of us who are in the world of advocacy and connection. We want to make sure that people know where the connections are being made, but also where they're not being made so that we can encourage those and help people meet one another.
Thanks, Shelley. These next two slides are going to go over some of the funding structures of Title VI programs, this slide is very telling that almost 60% of Title VI programs have reported that their funding decreased over the previous 2 years. Only, barely almost 30% said that it had remained flat, and a little over 10% reported that their funding had increased. And as Shelley previously noted when we were discussing the evidence-based programs, is, despite these funding challenges, we do see a lot of Title VI programs being very creative and innovative and coming up with different ways to provide services to the elders in their community. But access to funding sources is a challenge, but that could be overcome for a more comprehensive and integrated system within the tribe with strengthened partnerships and better collaboration on some of the things that Shelley had just mentioned, like transportation services that could potentially be available. We also asked about what they anticipated their funding to be like for the coming 2 years, and it was about split down the middle, with a little over 40% that were optimistic that their funding levels would remain flat. A little over 40% anticipated that their funding would decrease. We didn't see many of the anticipated funding increases, probably given what had happened over the previous 2 years. But that could also, always be a possibility. Some of the specific changes in response to these financial constraints and the decrease in funding are represented here on this slide. 30% of organizations reported that they did not have to make any changes due to financial constraints, but 70% of Title VI programs had to undertake various changes to the organization or their operations in order to maintain the programs within financial constraints. And the most common actions taken were reorganizing the program, cutting or eliminating business travel, and cutting or eliminating staff training. I also think it's important to note here that, although there was a number of different actions taken, proactive and strategic reorganization, changes to operation, changes directly affecting the staff and clients were the least common. And so the Title VI programs were very cognizant of implementing other changes and taking other actions in response to financial constraints before allowing those effects to reach the consumers. We also looked at, the building of infrastructure to expand services and sustainability, even despite some of the financial constraints. And Title VI organizations are beginning the process of building an infrastructure that will permit greater sharing capabilities with other agencies. More than 2/3 of Title VI programs have completed or are making progress to develop collaborations with Title III organizations or area agencies on aging, providing a seamless intake and assessment and eligibility processes. They're improving the way they maintain information about elders and improving their information and referral assistance programs. And so despite these funding challenges, we do see progress being made within Title VI programs to really build their infrastructure to expand services.
I think this is a trend that we're seeing really all over the country, pretty much everywhere, because we're all focusing on outcomes and how to justify our existence from one way to another. And anecdotally, there's no question, but there have always been concerns about the data issues that either do or do not exist in Indian country. And I think it's really important that tribes are focusing in on what they're actually doing, and that Title VI directors can now look at databases or even just mark sense forms and say, okay, this is what's happening. I can count that I served 25 people and they asked me about Medicare enrollment. therefore, that's maybe someplace I can do training. And I did hear that a lot with the surveys, talking with people about that's how I figure out where I need to go. I look at my data and I determine what needs to be done over the next year for training or for educational opportunities for the elders themselves, or who the next collaboration will be with. Do I need to go to the SHIBA or SHIP program within the state, or how do I get the information that I need to provide for my elders? And so it was heartening to see that not only are the data collection methodologies improving, but also that people are actually taking the initiative to act on what they're collecting. And so there's a huge connection with what we're doing and what we're not doing and what we need to do. So I felt like that was really critical. And I was frankly quite surprised at the number of tribes who cited their data as a way to get back to, the program design or the needs of the elders.
And along those same lines, we also see a number of Title VI organizations that are using a variety of business practices to further develop their programming. The most common is ensuring that there is culturally competent staff and providing training for their staff. About 80% reported that they are conducting needs assessments in their area. 75% report using information about elder outcomes, which goes back to what Shelley was just talking about, the data collection, and how I think, across the board, we're seeing this request for showing outcomes information. almost 74% are conducting outreach. And so a number of other activities that tribal organizations, the Title VI program specifically, are really engaging in to enhance their capacity and operating with some business principles to expand their services.
And I think that that top on helping culturally or having culturally competent staff, clearly if a tribal member is a member of the tribe and serving their own people, that it doesn't get any more culturally competent than that. But there's a take-home message for those of us who are working on Title III, Title VI coordination and making sure that our staff are culturally competent when we're working with tribal members. So because that is so important, nearly 90% of the Title VI programs identify that as important, which means that if it doesn't exist, you've got a barrier, and that barrier needs to be overcome.
So, Shelley, I've always wondered about this question because we've had it in all three surveys. So and wondered why we had it, because to me, of course we work for a tribe, we're going to be tribal and culturally competent. But you see this as they're talking about outside staff, huh?
I think that that's true because we're talking about them doing some training with, for example, if they've got a new IHS physician who comes in and they've been well trained in Indian country, but maybe they're not used to working with Zunis. They can make the comments to that and making sure that they're not committing the cultural faux pas that are going to prevent them from being effective in the community. And I think so often, because so many of the elders that we're serving they're really very traditional, and the cultural values for them become even more important than for others, and they become even more of a barrier than for potentially younger people with more exposure. I think that the point here is that Title VI directors really recognize the importance of it, recognize the importance of overcoming the barrier, and are willing to carry the flag for this, and are doing a lot of the training as well, and making sure that the elders do not experience embarrassment or, other negative interactions with people who are not culturally competent.
Okay. I noticed there's some CMS staff on here. Maybe that was written for Jim Lyon. Go ahead.
Poor Jim doesn't even have a chance to talk about that.
I know. That's why I said. Go ahead.
And so one of the final things that we always conclude the the survey with is asking about what are the training and technical assistance needs of the Title VI programs. And almost all programs reported that there was a training or technical assistance need that would help their organization in enhancing, developing, and implementing home and community-based long-term care. And not surprisingly, the most common is locating funding sources. And actually, half of the top 10 reported training and technical assistance needs were really related to funding streams. And we think that training and technical assistance in this area is crucial. Over 80% of Title VI programs reported that they do not bill Medicare or Medicaid for any of the supportive services that elders receive in their communities. So, as we're talking about what are the opportunities for further training, technical assistance, and collaboration, that kind of jumps out at me as being a key one. With almost 20% of Title VI programs reporting that they do bill Medicare or Medicaid, 30% of those, so 30% of that 20, report that they bill both Medicare and Medicaid for some of the supportive services they provide. Slightly over a half of those that reported billing Medicare or Medicaid bill only Medicaid, and about 16% of those that report billing either bill only Medicare. So I think by learning the ways in which a more diverse array of funding sources can be used, and how Title VI programs can receive some training and technical assistance along these lines of funding streams, can really help create a more integrated system and expand the types of services that are delivered to elders.
And I think this one also speaks loudly. There isn't a thing on that list in front of us that doesn't talk about a possibility for coordination between Title III, Title VI, state units, even federal regions, to go in and help people understand what is Medicaid and how do I help an elder get involved in it and take advantage of the benefits there. Understanding long-term services and supports, I was amazed at the number of elders programs that really do not understand what's going on in the movement towards home and community-based services and are really in need of teaching and training and understanding. And these areas can be very difficult, but they really do speak to local collaboration. At the federal level, we can certainly talk about what is a Medicaid waiver, but each state determines how that waiver is going to be implemented and what it's going to look like. And so this is something that really falls on the shoulders of the local AAAs, the local Title III programs, and others who are in a position to really do the on-site, hands-on teaching and connecting elders with services that they need. So here's a kind of a menu of things for those of you who are looking for how to collaborate, how to work together. This is a list of things that tribes would certainly appreciate.
Shelley, do you want to talk about the work we started with Medicaid? Just give a little summary of it so folks are aware it's down the pike.
Yeah, Cynthia, I don't know. Frankly, I thought it was a little bit of a wild hair crazy idea, but she got a group of people together in Denver. They sat down and started talking about how can we work on I'll call it a primer or a guidebook for tribal communities to work within the Medicaid system to seek services in their communities. And it is working in draft form at this point in time. I think there are several people that are still writing on it, but it's something that was really amazing to see some of the results that came out of it. And the people that were gathered are people who have done very successful work with Medicaid funds and brought a host of programs to their tribal communities, as well as people who maybe have just been involved on a tangential basis but really understand the need. So I am really looking forward to seeing that product and seeing it available to tribes. I don't know, timeline-wise, I don't know what the goal was then.
The goal is April.
Okay, great. So it should be hot off the presses.
Thanks. Go ahead, Mary.
Okay, well, that actually concludes our formal presentation. So here's my contact information if there were any questions, follow-up questions specific about the survey results that folks were interested in. And so now I think that we want to open it up for questions and discussion, and hear the thoughts of the folks on the line about some of the points that we already discussed here today. I think particularly in terms of collaboration with Title VI programs, and how organizations within the tribal community and without can really help better leverage and utilize the Title VI program services and enhance the capacity of the overall systems to provide services to elders.
So as we move into our time for questions and answers, there are two ways that audience members can participate. If you're called in on your phone, you can press *6 to unmute your line and ask your question over the phone. If you're not called in over the phone, you can type your question or comment into the Q&A box that is in the bottom right-hand side of your screen. We have some questions that have already come in through the Q&A box, so I'll start with them. Neil Minogue asks, will this data be available for individual states?
So unfortunately, we do not have that information available for individual states right now. We would have the capability to break this down because we do collect that information from folks. I think, Cynthia, Aaron, that might be something worth discussing, whether we want to break this down by state. Or if there are specific questions or topic areas that we would want to break down by state, if not the entire survey set.
The next question is, I believe it was related to the slide about what collaborations or partnership relationships are most common for Title VI programs. It's a question from Jackie Gray that says, were the APS or elder abuse services provided by tribes or states? The majority of tribes don't have elder abuse codes. Can you comment on that?
On the most common services provided, partnerships. Shelley, do you have thoughts on this one?
Yeah, I think as I was talking to people, it was all over the place in terms of their knowledge and understanding of of APS services. But the vast majority of the services were not provided by the tribes. They were done in collaboration and partnership, either through a local agreement between the state and the tribe about how APS was to act when they came on to do an investigation, not only on the reservation, but also if, in fact, they became aware of an elder in town that was struggling with elder abuse, how the tribe wished for them to be approached and dealt with. And so I think a lot of them were done through collaboration and have seen some really good work done there. The other thing that I'll point out, too, Jackie, is that a lot of the tribes talked about having what is effectively an elder protection team, or an A-team, where they would have people come together on a regular basis, which included, tribal law enforcement, housing, the clinic, but also people from town who came in from either the area agency or from the state APS or whoever was providing APS to come in and talk about and staff individual elders programs. And so I think that's probably where a lot of those partnerships were taking place, was either through an agreement, which was a written agreement, or through these elder protection teams that were being used. I was pleased to see that tribes are reaching out and recognizing elder abuse, and I think that really honestly lies to a great extent on your shoulders for raising the issue and raising the awareness that we have about elder abuse in Indian country. And so thank you for that.
Yeah, and I'll just add that you do have the option to download the full Title VI report through this webinar platform, and there is an entire section within the report about elder abuse prevention and the services that are offered in communities. And just to highlight a few of those is that it was, over 90% of respondents reported that there were investigations of abuse, neglect, and exploitation, and case management for victims of abuse, neglect, and exploitation. And Title VI programs specifically took the lead in assisting and educating elders and the general public about elder abuse, neglect, and exploitation. And they were also it was also very common, about 25% of Title VI programs reported taking the lead in providing case management services for at-risk or vulnerable elders. So, again, just a few of the highlights from that section of the report, but there is a whole section of the report and the survey that we did on elder abuse prevention within the tribal community.
There are some additional comments in the Q&A box regarding the discussion on elder abuse. Jackie Gray says, thank you, Shelley. The NRC NAA data in Cycle 5 showed that 1.1% of elders used elder abuse services and 12.5% would use them if they were available. Another comment is from Marcia Hall, who says, the Shoshone-Bannock tribes enacted in 2009 the Elder Abuse Code, and that she has been working in coordination with area agencies on that issue.
Great.
That's really good news.
Excuse me, would you repeat that? I'm sorry.
Repeat the comment?
Yes.
The one from Marcia Hall about the Shoshone-Bannock tribe, or the one from Jackie Gray about...
the one from Marcia Hall.
She said that the Shoshone-Bannock tribe enacted their Elder Abuse Code in 2009, and that she has been working to coordinate with area agencies on aging.
Fantastic. Thank you very much.
Mm-hmm. We've got another question from Tammy Safez, who says, when is the next survey due, and when will we get a notice?
That's a great question. So the next survey for the Title VI programs would be going out in early 2017. So, we'll really start planning for that in 2016. And launching the survey in 2017. And we have been in discussions with Cynthia and others, and Aaron and others at the Administration on Aging and Administration for Community Living on how we can really make sure that the next round of the survey captures the information that is going to be the most valuable, and ways to do that. I think we've been, this is the third iteration that we've done this survey, and although it produces really valuable, critical information, we also always make sure that we have Title VI directors as key informants that participate in the survey development. We want to get creative with this next round of the survey, and maybe switch it up to see how we can really produce the information that's going to be most beneficial for tribes to use, for Title VI programs to use within their communities. Cynthia, Aaron, I wasn't sure if you guys had anything you wanted to add about the next survey.
I don't. I just do what Aaron tells me to. So, Aaron?
Nope, we're just looking forward to, as you said, mixing it up and seeing if we can call out just a little bit more specifics and information that'll be valuable to everyone out there to help build their capacity.
We've got a comment or a question in the Q&A box that relates to the next survey. It's from Lynn Gall, and Lynn asks, is it possible for the next survey to collect data on dementia services? Our state is in the process of redesigning and improving our dementia care system, including the creation of tribal dementia care specialists. Having baseline data on what tribes are doing now in the areas of dementia would be very helpful.
As the person who runs our dementia programs, I would imagine that, yes, that is an absolute possibility that we will include in the numerous topics that we are going to consider.
Lynn, thank you for that question. This is Cynthia. We also have collected some Alzheimer's information in both the latest round of Title VI applications, which are being analyzed now by Region 8, and then we have some questions in the needs assessment that UND does on an annual basis. So if you need more information about what UND may already have gathered, please contact either Wendell, Holt, or me. Thanks, Lynn.
Okay, let's take just a moment to give listeners who are on the phone a chance to unmute their line and ask a question if they'd like to. So if you're on your phone, you can press *6 to unmute your line and ask the question. All right, let's return to the Q&A box. I've got a few additional comments from Marcia Hall about the elder abuse prevention topic. She says, in fact, and again, this is the Shoshone-Bannock tribe, she says, in fact, we've been working on our 5th annual elder abuse prevention event with a variety of topics: addiction, depression, diabetes prevention, and bringing a key speaker in each year, Wilson Wewa. It's been a positive event that has brought much awareness. And she also says, what's been nice about the information on dementia and other health concerns is utilizing local home health agencies.
Thanks for sharing.
I'm not sure who submitted that, but I'm sure they're paid by Wilson. We will.
Are there any other questions? We'll take just another couple moments to let questions come in if we've got any.
Shelley, did you have any kind of final summary on your thoughts in conducting the survey and kind of what all of this means in a nutshell? And how just tell me this. Yeah, that's what I want to know. I want you to kind of summarize for me.
Well, I think what comes to mind, first of all, is the diversity with which the programs are operated and the diversity of the background and activities of the directors. They are everywhere from soup to nuts. We have people with master's degrees. We have people who clearly graduated from high school. We have people who are, just kind of all over the board in terms of their understanding of the programs and how things work. But the universal thing that struck me over and over again, aside from the fact that people kept hanging up on me because they thought I was a robocaller or something. But I think the thing that struck me more than anything was the investment that all of the directors have in the well-being of their elders. And their focus is so much less on themselves or their own salary and so much more on the elders and their importance in the community. And I think my take-home message was these people do great work. They are proud of the work that they do, and rightfully so. I can't tell you, you're aware, you've been involved with it for a lot longer than I have been, but how wonderful it was to see them in action and hear about the things that they were doing and hear their enthusiasm that in spite of flat funding or loss of funding, they're looking for new ideas and new ways to implement services and connect with their elders. So to me, that speaks loudly about the quality of the programs and the quality of the people that work within them. So that was really kind of my summary of the whole experience.
Thanks, Shelley. That's excellent.
We've got a few additional comments that have come in via the Q&A box. On the question of collaboration between states and tribes, Ernest McKinney says, tribes need to connect with the state Medicaid agency, not the AAAs, to begin discussions on Medicaid-funded LTSS. Are there any comments on that? Go ahead.
Yeah, I'll respond to that particular one. And that, Ernie, I think one of the things that's so critical about your statement is that's absolutely true in some states and absolutely not true in other states, because in some states it's run by the Medicaid agency and in other states it's not, which is the reason that tribes are really struggling to try to learn more about what's being offered. I think that Cynthia's gathering the group in Denver and getting people together to talk about the basics about Medicaid is critical, and there will be some things coming out about that. But it does also speak to the fact that the technical assistance on Medicaid services in a particular state need to be offered from people in that particular state. There's no place like home in terms of good information. And sometimes tribes are knocking on doors because they've heard from a tribe in Nebraska that this is the way it's operated. And that tribe might have known perfectly how it worked, but the tribe that they're talking to is a cousin in Montana, and Montana's service is totally different. Access is totally different. Requirements for getting in are totally different. And I think it really means that those of us on the local level who are going to be working with tribes need to sharpen our pencils and make sure that those relationships are established so that people are not barking up the wrong tree.
Right. Yeah. And I completely agree with that, Shelley, and thank you. And, I think just to add in there that although, it would be critical for tribes to engage with the Medicaid agencies, in a little over 60% of states, it is the Area Agency on Aging that administers the HCBS waivers in their states, and showing all of the changes that are happening at the state levels, and so many states that are also getting involved in LTSS and dual demonstrations and various other activities. The AAA may be a more accessible, or at least more accessible immediate partner for some of the Title VI organizations to learn more about the Medicaid HCBS waivers, and think about other partnerships and collaborations that can happen at the local level to really support Medicaid statewide.
Hi, this is Florence Ida. I have a question.
Hey, Florence, Ida.
Hi, how are you doing? You're talking about long-term care services and Medicaid. Do you think there would ever be like a step-by-step process on how we can do that? I know some tribes are doing it, and each state is different, but maybe we can work with our regional office somehow to make that connection so that, because a lot of tribes do supportive services, but they don't bill Medicaid. And I would like to know how we start that process.
Shelley Zylstra?
Yeah, I think, Florence, one of the things that was one of the reasons that Cynthia got that group together in Denver to kind of try to rope that together and figure it out. And it's really complicated, and I wish there was a way to say, first do this, then do this, then do this, and you'll be successful. But the issue is that it is locally driven, locally defined. Each state has their own process. And so calling your regional staff and asking them to help to connect you with the person in that state, that can help you out is probably the best bet for you at this point, because you likely know that person and have worked with them on other things. And if you're struggling, there's all kind of folk all over the U.S. that are really willing to help you and try to steer you in the right direction. So I guess the take-home message there is don't sit silently by not knowing what to do. Start doing something, and somebody's bound to connect with you and help you in that process.
Are there other questions over the phone? Okay, well, let's move into closing our webinar. We're about at the top of the hour. Shelley, you shared your kind of summarizing thoughts about the survey, but I want to ask if any of the other presenters have concluding thoughts as we wrap up.
This is Mary. I think as I stated earlier, we've gotten some really critical and a wealth of information from this survey, and we could not be more grateful to the Title VI directors who participate in the survey, but and especially Shelley, who spent countless hours on the phone with folks gathering this information. And just that, we're really excited for the next iteration, and in 2016, which is just right around the corner. I'm sure that we'll be reaching out to many of the folks that are on this webinar today to gather information and start collecting background about what is going to be the most important topics that we should ask about. And I've already marked dementia as one request, and I'm sure we'll be getting many more. So thank you for your participation in today's webinar, and hopefully we'll be back with you in a few years with even greater information to share.
Thank you, everyone. We'll talk with you all soon. Let us know if you have questions.
Take good care. Bye-bye.
All right, today's webinar is concluded. You may disconnect. Thanks for joining us today. Thanks.